Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to share this week's update for the COVID-19 pandemic for the week of July 26, 2020. As I always do, I like to remind us that this has been a progressively growing pandemic that started at the beginning of this year and has been growing inexorably ever since then, passing 500,000 deaths by the late part of June and continuing to grow, such that by this week there's been 650,000 known deaths and 16 million confirmed cases worldwide. But remember, this is a significant underestimate because there are many parts of the world that simply don't have the capacity to either test or report their diseases. As I've mentioned before, we're seeing very different patterns evolving in different places. If you look at Belgium, what you see is that after very rapid growth, and they're one of the most impacted countries in Europe, for the last several months, they've seen virtually no growth, so what we would call a mature epidemic. The United States, on the other hand, has not leveled off quite as much as Belgium, but it's not growing as rapidly as we see in Brazil. So it's helpful to think of the world falling into three patterns: a mature epidemic, a transitional epidemic as the US is seeing, and then still a growing epidemic as we're seeing in Brazil. If we look at the five most impacted countries, in other words, the most deaths per million on the continents, Africa has almost doubled in the past month for those five countries. Asia has gone up over 150%, but that's largely because of Kyrgyzstan, which has been grew 400% in the last month. Europe, however, less than 5% growth. The Americas, 35%, North America, 35%, South America, 81%. Even if we take away Kyrgyzstan, what you're seeing is very different pandemics evolving in different parts of the world. And while the epidemic began in China, it clearly hit most dramatically in Europe, which is fortunately seeing now a very slowing epidemic, as we've seen with that mature epidemic in Belgium. There's the US at 17.8%. Again, doing a lot better than other countries, but still nowhere close to the slow growth that we're seeing in Europe. In the US, we saw our first death in early March, and it's been growing progressively ever since then, passing 100,000 by the end of May, and now getting very, very close to 150,000 deaths and over 4 million confirmed cases. As I always do, I want to remind us, if you look at the top 10 leading causes of death in the United States and estimate how many deaths we would have had in the first 6 months, COVID-19 would be in the top 5, probably around number 3. This is a serious pandemic. And what we've seen in the US is we see initial growth in the number of cases. It dropped and then it's grown again. And it may be leveling off now, but we'll have to wait and see. Every week I look at cumulative deaths per million. And early on, it was growing very quickly, as you saw with the pandemic. Then it began to slow. And then the rate of slowing has actually slowed down itself and increased slightly. So we're still in this transitional phase. We're not leveling off. We're not getting close to 0% growth every week. If you look at the new cases again, rises, falls, rises, now perhaps levels off a bit. In terms of deaths, the deaths grew very quickly in the beginning, have dropped, and then now we're clearly coming back over the last month. If you look at hospitalizations, again, early on, these very, very rapid growth rates, then it started to slow. And now I think for the 6th week in a row, we've actually seen an increase in the rate of hospitalizations. So we're still clearly not out of the woods with this. And just as we've seen globally, we see within the US different patterns. If you look at New York, very much a mature epidemic, not much growth going on there. If you look at Virginia, it looks more like the US. It's slowing down, but not as much as we might like. And South Carolina, on the other hand, is growing, as is our state of Tennessee. If you look at the 5 most impacted states, in other words, the states where the epidemic hit the hardest, and compare them to the 5 median states and states in the middle of the pack, what you see in the last month, the most impacted states have not grown very much, 5.7% in total deaths compared to almost 50%. So what we're seeing is this movement towards a mature epidemic. And hopefully all of these other states, these median states and the ones that are worse will actually start moving and start slowing down over time. There's a great deal more information on our website. Go to the College of Public Health website and hit this icon. Or if you have any specific questions, please let me know. I'd be happy to try to find an answer for you. Thank you very much.